You're listening to a Raconteur Studios podcast.
Hi, I'm Dr. Emma Craythorne. I'm a consultant dermatologist, and this is the After Hours Skin Clinic. Expert skin advice on those questions I'm always asked outside my clinic. And you're probably the same, Ellie.
Always, yes.
Today I'm joined with Dr. Ellie Rashid, another consultant dermatologist, also my partner in clinic and one of my best friends.
Your best friend, full stop.
So today we're going to be talking about how to wash your face and how to cleanse your face. Do you wash your face, Ellie?
Thanks very much. Yes, I do. Do you?
Sometimes. That's not true. I wash my face every single day and twice a day.
I did actually go through a phase of not washing my face when I was younger. Because you know when you wake up and you look quite glowy? Well, I thought glowy. Now I know sweaty. I was like, oh, well, I don't want to wash away this wonderful glow that I've got overnight. So I went through a phase of not washing my face.
There are actually a lot of people who say not to bother washing your face first thing in the morning and you don't need to bother doing it. I mean, I'm not sure I agree. In fact, I do not agree with them. But yeah, there is a school of thought that you don't necessarily need to wash your face in the morning because it hasn't got that dirty overnight.
But you are sweating a lot overnight.
I agree.
I mean, that glow is just sweat, really.
I agree. I also think that if you've used a topical solution overnight, so say if you're using your topical retinoid, and you know we do love the Clear Special.
Yes.
We're both massive fans of making sure that we are using our retinoid at night time. Then the next day, because that essentially is working as a chemical exfoliator, you know, that's going to be working to get rid of some of those dead skin cells on the surface. But also, it is a treatment, it's another chemical, and you know those chemicals start to break down, so you want to make sure that you've just not got old chemicals sitting on your skin, right?
And also when you use your antioxidant serum in the morning, you want to put that onto a cleansed face. You don't want to put that on a sweaty, grimy face.
Yeah, so I think we're both very much in the camp that we're going to be doing washing our face twice a day.
Yes, morning and evening.
So why do we wash our face, Ellie?
So in the morning, you wash your face to scrub off the sweat and also any products that you might have put on in the evening. And then in the evening, you're washing your face because you want to wash off the SPF, the pollution, all of the grime. I mean, you only need to sit on a London tube and then blow your nose and look at all the dirt that comes out of your nasal mucosa.
I know, it's so true. I always think as well, if you go by an old building and it's not getting washed and everything in London, you know, you've got all of the pollen from all of those London plane trees, you've got all of the pollution from all of the cars, it just builds up. So if you don't wash that off, it's just going to build up like those dirty buildings.
Yeah. So definitely wash your face twice a day for sure, for those reasons. But the way in which we wash our face, so I used to always be like, oh, just use any old cleanser, totally fine, doesn't matter what you use. But I think now the formulations have really improved, and why not be a bit more selective about the cleanser that you use for your particular skincare concerns?
Yeah, I think that's right. Back in the olden days, people would have just used soaps on their face.
Olden? We're not old.
My son did actually use that word for me. He said, did you have colour whenever you were younger? And I mean, what, colour TV? And he's like, no, just everywhere.
Oh, that's so sweet.
I was like, yes, we definitely did. I'm not that old.
Yeah.
But originally, we would have had just soaps, essentially. So these bars of soaps.
Yeah.
And actually using those on the face particularly can be really, really very drying. It disrupts that skin barrier and you kind of end up losing a lot of lipids from the skin barrier. So that's the fatty substance that helps to keep our skin kind of hydrated and moist. So it's a lovely barrier. Using a soap on that strips the lipids out of it, and that's why you often end up with that tight feeling of the skin afterwards, or a squeaky kind of skin feel.
Yeah, which I used to want when I was younger. I was like, well, it's doing a good job. Great. My skin is clean, but it's screaming for moisture.
And I think actually probably that was why half the time moisturizers were then kind of developed, essentially, were to counteract this really harsh soaps that we used to use.
Yeah.
So soaps came along first, wonderful, cleanse the skin, but also completely stripped the lipids out of the top of the skin. And then moisturizers were invented to then replace that.
Yeah. And you only had to look at your bathroom. I mean, if you just used those bars of soap, all the scud all over the bath and the shower.
So what do you suggest now for cleansing of the skin?
The La Roche-Posay Syndet.
Do you like that one?
Yeah, love it. Oh, what's the brand that I'm using at the moment? Oh, the Uriage one. Uriage Zemos, I think, is their range.
Yeah.
Xemose. They've got a lovely cleansing, like a cleansing oil almost.
And you touched on the word syndet. So do you want to talk about what that is?
Yeah, so syndet is short for synthetic detergents. And it's an ingredient that's in lots of the cleansers currently. Essentially what it does is it binds or attracts dirt towards it, and it washes off the dirt with it. So I think it attracts water at one end and dirt at the other end of this chemical formulation, and then it takes the dirt with it away.
Yeah, and these things are not very stripping then of the skin, so they're able to cleanse the skin and get rid of the dirt without the way that a soap used to.
Yeah.
So before, these surfactants were very, very stripping whilst they were getting rid of the dirt, but the synthetic detergents or syndets are just a little bit more sophisticated. Well, actually a lot more sophisticated, really.
Way more sophisticated. And also doesn't leave your bathroom with all of that film that the soap bars used to leave.
Who taught you how to wash your face?
Do you know, I don't think I've ever been taught how to wash my face, but I think I just watched my mum wash her face. My dad just has a shower, so I wouldn't see how he does it. But I guess it was just really watching how my mum does it. If you were to look at an advert, though, do you remember when we were younger, like in the 80s and 90s, the adverts on how to wash your face would be like water splashing in an outward direction. And so you'd think like you would just do that, but water would just get everywhere. So yeah, I wouldn't use adverts to learn how to wash my face. It's probably just watching my mum.
I think that's right. We don't actually ever formally learn how to wash your face. It is just from watching others.
Yeah.
And so you can often get into bad habits if the person that you've watched hasn't actually learned how to wash their face properly.
My mum probably watched her mum.
You've had some people come to you who haven't been able to wash their face, is that right? Or they don't know how to wash their face properly?
Yeah, I did a skin masterclass on how to cleanse like a dermatologist, which was aimed at men. And so they're these male influencers. And we did a little session on sort of how people were cleansing their face and what they were using. And I remember there was this one particular guy and he would use sort of food products to cleanse his face. So he'd make up this bottle of water and put lemon juice in it, a little bit of vinegar in it, and then would use that water to wash his face rather than the water from the tap.
Really?
Yeah, genuinely.
What, with additional kind of synthetic detergent or just...
No, that's it. That was the formula.
Okay.
There's a lot of learning to do.
And so whenever you're telling somebody how to wash their face, what are your steps?
So my steps are usually to use sort of warm water. So there's this whole thing about using ice cold water, and it's meant to sort of close your skin or close your pores. And there's this common misconception that our pores sort of have the capability of opening and closing. Pores can get clogged up with dirt and grime and things, and we just want to soften that and then cleanse that away. So your pores don't open and close, but you soften the stuff that gets stuck in it. And so you can't use ice cold water to forcibly close your pores in any way. So I just say use lukewarm water, whatever you're using to cleanse your skin with, so whatever cleansing gel or syndet that you're using, rub that onto the skin, usually for around 60 seconds, between 30 and 60 seconds, and then wash it off with lukewarm water. I'm not a big fan of the sort of micro beads or sort of little pearls that are in cleansers.
I'm not a fan of those either.
No, sometimes it can feel quite nice. Again, it's that sort of historic feeling, isn't it? Of like...
You've scrubbed yourself
clean.
Scrubbed
yourself clean, yeah. Do you remember Apri, the apricot one? That was like all the rage.
I remember that. But I mean, it was very harsh on the skin.
Extremely harsh on the skin. And I'd be there like really rubbing that stuff in. I was like, oh, it's a good cleanse.
I taught my teenage daughters how to wash their face. And on the back of that, I ended up doing a little tutorial for a school teaching children, well, teenagers, how to wash their face. Because there is so much information now from all sources and social media telling people what they should be doing to wash their face, which is almost the exact opposite of we had, where we just watched our mother or father wash their face. But actually, it's exactly the same thing. It's obviously not a difficult thing to wash your face, and it should be as quick and as simple as possible. So my tips were obviously find the nice synthetic detergent that you like, and a very easy go-to is the Cetaphil Gentle Cleanser. That's an easy, reliable one. Or one of the CeraVe Hydrating Lotions.
Yeah, they've got all types of cleansers now. So yeah, hydrating cleanser, salicylic acid cleanser.
So pick one of those that's very gentle and calming on the skin. This will be for most people, I would suggest using this. And then put it into your hand with a little bit of lukewarm water and rub it into a bit of a slightly more of a cream, really, and then washing the face with it, just like you say, for 30 to 60 seconds, and then rinsing it off with the lukewarm water. Some people, if they want to have more of a sensation, will actually like to use a flannel. So I always recommend cotton flannel rather than anything that's got lots. And if you're really going to get into it, it's the looped cotton flannel. So that each of instead of just a fibre coming up with a point, it's a looped fibre. So the fibre comes up, loops round, and then goes back in again. So it's made up of millions of those. Well, not millions probably, but hundreds of thousands of these little fibres coming up, making it even softer. And then gently rubbing the skin with that, and then patting the skin dry. So that would be my kind of key on how to wash the face. But then I got asked, well, everyone suggests to do a double cleanse. So what do we do for a double cleanse?
I do a double cleanse.
And yes, and I said, so I think a double cleanse is really useful if you've got makeup that needs to come off.
Yeah.
So tell us why a double cleanse might be important.
Yeah, so the premise of a double cleanse is that you use an oil-based cleanser as your first cleanse to remove your SPF or whatever else you've put on throughout the day and your makeup. And then you immediately after go in with another cleanser, usually a gentle, creamy cleanser, to wash away all of that. So it's like a optimal way to make sure that you're cleansing your face, but without stripping your skin of any of its natural oils.
Yeah. And I think that again goes back to the point of everyone's skin will need something slightly different. And so for people who will wear makeup in the day, or for people who are going to get particularly sweaty and like kind of got very oilier skin, or for people who are wearing a lot of SPF in the day, actually to do a double cleanse at night is a pretty sensible thing to do. You don't necessarily need to do it in the morning, but certainly at nighttime is a sensible thing to think about.
Yeah, I used to do a double cleanse before double cleansing was a thing. I used to just use the same cleanser, but I never found that doing it once got everything off. Well, I've always worn makeup since I was quite young. So yeah, I used to do a double cleanse before it was trendy.
So what is your double cleanse items of choice?
So the first one that I use to take my makeup off is by a brand called SVR, Sierra Violin Romeo.
I love that one.
Yeah. The Cetaphil, I think it's called.
Yeah,
that's my first oil-based cleanser. And then at the moment I'm using the CeraVe Hydrating Cleanser as my second one.
Yeah, I love it.
What's yours?
So my Cetaphil Gentle Cleanser for the gentle cleansing part. And if I'm doing an oil cleanse, then the Hado Labo.
Nice, yeah.
The Hado Labo oil cleanser. But you can't get it in the UK at the minute.
What?
Yeah,
Out
I've
of
been
stock?
able to get it for about 2 months, yeah.
Is there any listeners that are making their way over?
And because I then recommended it to so many people.
That's where you've gone wrong.
I know.
It's out of stock. You've recommended it too much. Stop giving away your secrets, Emma Craythorne.
I know, that's why my recent holiday I had such a lovely time. And my husband's like, don't tell anyone where this is or we'll not be able to get a booking again. That's it. I'm not telling anyone my secrets anymore. Can't get my favourite oil cleanser.
Yeah, keep that to yourself.
What about instruments for cleaning the face? Because, everywhere you go, somebody's come out with some new gadget for the skin.
Yeah.
A gadget for this, a gadget for that. As soon as one company's brought out a gadget, then everyone has to bring out a gadget. Do we need a gadget for cleaning our face?
So I don't think so. I think they're a bit gimmicky and you don't need to spend your money on it. I just use my fingers to wash my face and I don't even use like a microfiber cloth or anything like that. Literally just use my hands and then pat it dry with a towel at the end.
Any patient situations where you are recommending any gadgets?
No, I actively dissuade some patients from getting it done, particularly those that are acne prone. So you use like this little Clarisonic was the one that was really popular at one stage. but they were just traumatizing their skin too much, and it was making the whole problem worse.
Yeah, I agree, because whenever we think about acne, it's little tiny bits of inflammation actually will often trigger the next stage in acne. In other words, making your acne worse.
Yeah.
And picking at your acne, squeezing your acne, and using gadgets that are really kind of can be a bit traumatizing to the skin actually all make it worse. So I agree. I would actively dissuade some patients from using these instruments. I always think it's a bit of a, I mean, you've fingers, maybe if you don't have fingers, but if you've got fingers, you can wash your face then.
Also, I worry about how sort of hygienic they are if you're just leaving them around in the bathroom like for months and months and months and months. And are you cleansing the cleansing brush adequately?
Yeah.
That's what I sometimes think about.
Yeah,
These
I
are
mean,
things that keep me up at night.
I agree with you actually, because now that I'm thinking about it, it's pretty disgusting, really, isn't it? If you've got something that's been able to grow all kinds of things on it. Yeah. I wonder then if we're using some of these devices that have been left around, allowing things to grow in them, are you then transferring bugs around? I wonder, could it actually make certain skin conditions worse?
Yeah, I don't know if they've looked into that. I'd love to know.
Yeah, so would
Just
I.
from just thinking about it myself, though. I mean, how effectively are you cleansing a cleansing brush? I think about that with any like scrubby brush, loofah thing that's in the bathroom. Just think it's getting moist and damp and it's being left there for months and months.
In a warm environment, which humid, yeah.
Yeah.
I actually did have a patient once who had a Pseudomonas folliculitis. So Pseudomonas is a bacteria that it lives in kind of warm environments, and it has a pretty stinking smell actually whenever you get infected with it. But for her, she developed a Pseudomonas folliculitis, and it was from a brush that she had in her shower. It was one that she would fill with a shower gel and then use that to wash her body, and that's what it is. We cultured it and had Pseudomonas in it.
Oh my gosh.
Yeah.
And also you can go in quite hard with those brushes.
Yeah.
So I think you can traumatize the skin quite a lot just through the physical force of brushing.
Yeah, so I think all in all, when we're washing, we should just use the very special gadgets that we have on the end of our hands, which are our fingers.
Perfect.
And then some of the other fancier things that we can use for cleansing our skin. So as well as the synthetic detergents that we talked about and the oils, which are suitable for dissolving oily substances on our skin, there's also other ingredients like salicylic acid.
Yeah, so twice a week I tend to use a cleanser that's got either an alpha hydroxy acid like lactic acid or glycolic acid or beta hydroxy acid like salicylic acid within the cleanser. If you use it every day, I do think it can irritate your skin. So definitely just 2 to 3 times a week. But I do feel like it gives your skin a bit more of a glow to it using an exfoliating cleanser like one of those.
And it's probably really more relevant for people who have acne-prone skin or have oily skin, rather than somebody who has a drier skin type, or somebody who's just starting on a retinoid journey, for example. They might struggle with that, do you think?
Yeah, they definitely would struggle with it. But once you're established on your tretinoin and you don't have particularly dry skin or eczema-prone skin, then I think adding in a cleanser with those additional ingredients can be quite nice.
And then there's a lot of kind of fads or trends, isn't there, to use different kind of enzymes for cleaning the skin or hydrogen peroxide. Do you see any of these trends?
No, haven't so far. Tell me more.
So the hydrogen peroxide is like a super cleanser. It completely essentially kills any of the bacteria that we have pretty much sitting on our skin. And it's often being used after a regular cleanse, then using a hydrogen peroxide cleanse to get a even stronger version of a cleanse. And I think that can probably be helpful for some people who are maybe more prone to repeated kind of skin infections. But I think for the most people that's not going to be particularly helpful and actually might cause some disruption in our natural skin microbiome. I'm always a bit nervous about disturbing that natural skin microbiome.
Yeah, and with cleansers, I always think if it makes it difficult to do your skincare routine, then I'd rather you cut out the cleanser.
Yeah.
I'd much rather that you're able to tolerate your tretinoin at night, your moisturizers, your SPF, all of that, your vitamin C antioxidant, and then to remove some of these harsher or less tolerable ingredients from a cleanser.
Yeah, I completely agree. I think that the SPF and your nighttime treatment,
Yeah,
obviously we cover clear especially.
obsessed with it.
These two things are so important that the cleanser is to support those and
Yeah.
is not the active
No,
treatment.
it's the supporting act,
Yeah.
not the star of the show. The stars, as we all know, SPF, clearer, done.
So we've been talking about Clearer, and I suppose at this point I really need to interject and just explain what Clearer is. So Clearer is a company that I founded 2 years ago, and it's with the idea of being able to provide entirely personalised, luxurious, bespoke skincare. And it's combining all the knowledge that we have as dermatologists, and quite often that is prescribing things like medicines, isn't it? So tretinoin for aging of the skin. It's also for things like ivermectin for rosacea of the skin. But combining those medicines that we know with a beautiful and luxurious delivery method we call the vehicle. And it's combining these two things together so that people are able to get the optimal, best results for their particular skin. So your Clearer Special that you'll use at nighttime, Ellie, it's quite different to the Clearer Special that I will use. It will have different ingredients in it.
Yeah, I mean, I am the medical director, but I honestly, it's the best product that I've ever used to suit all of my skincare concerns. And it's just all in one, just takes the decision out of it. I know what I'm doing at nighttime, know what I'm doing in the morning, job done.
That's right, because we want to keep things as simple as possible, but we want to make sure that we're using the really effective ingredients. And for, the 10 years before I was in clinic and I didn't have Clearer, I was trying to get that best skincare to every single one of my patients. But it was really difficult with what was on offer. So we make up your Clearer Special for you. It's made in the lab, entirely fresh, and is delivered to you within 48 hours. And all you have to do is put it on your skin 2 pumps at nighttime. It's so easy. So, do you think that your skin cleansing patterns have changed as you've got older?
Yeah, so when I was younger, I used to be able to just use absolutely anything. I'm definitely more selective with my skincare choices now to support my skincare routine. I mean, it's really personal preference, but I prefer things that froth up. I like something that sort of washes off nicely. I'm not a huge fan of like a cream that doesn't lather up in any way.
So do you like that gel to foam cleanser? Is that the kind of thing that you like?
Yeah, even the hydrating cleanser from CeraVe, even though it comes out almost like a bit of a cream, but it does froth up and it does lather up when you're using it. I couldn't use like a moisturiser. You know, in eczema-prone skin where we say, just clean your skin with a moisturiser. Like the idea of that just doesn't sit well with me.
Yeah, I don't like that either. I like a little bit. I think that's why I always like to put a bit of water onto my cleanser in my hand to do that
get it
action,
going.
to get it going.
Yeah, get it going. Yeah, that's exactly what I do.
If we were thinking about, a general group of people, most people as they age, they don't really need to change how they wash their face.
No, maybe just as we get older, our skin gets a bit drier. So you might not want to use a cleanser that's got any of those more stripping, exfoliating ingredients that we talked about, like the lactic, glycolic, salicylic acid.
I think that's why it sometimes gets a bit confusing, because if you have somebody who's trying to do, say, a better aging skin routine where they, the better aging skin routine has got your alpha hydroxy acids in it, your glycolic acids in it, all of these quite harsh acids. Your moisturizer also might have, peptides in it, but maybe even more kind of brightening agents, again, slightly irritating agents. And then you've got your prescriptive treatments at nighttime. And actually, those things, if you're doing it at every step of your skincare routine, is just too harsh. Most people can't cope with that.
And I also think you should do things a bit more gradually. So doing it all at once sometimes can be a problem.
Yeah, cleansing, I think you hit the nail on the head. It is not the star of the show. It is there to support the other things. And, you don't need to spend a lot of money on a good cleanser.
No, I agree. Yeah. If you're going to invest, I'd probably invest in those stars of the show ingredients.
So what is your go-to product recommendation for a cleanser for oily skin?
So for oily skin, usually something like the CeraVe Blemish Control Cleanser or the Cetaphil Cleanser.
The Cetaphil Cleanser for oily skin.
Yeah.
Yeah, I like that one too.
Those are good budget ones, aren't they?
Yeah.
Like really cheap and cheerful.
Cheap and cheerful. And, I would recommend those to everybody. For dry skin, I would go for the Cetaphil Gentle Cleanser or the CeraVe Hydrating Cleanser.
Yeah. CeraVe Hydrating Cleanser. I like that one.
And if you want to spend more money on a cleanser, well, just make sure it's a simple one, but actually it's going to do the same job as the ones we've already recommended.
Yeah. They've come so far.
Yeah. The other one as well I really like are the synthetic detergent bars. So Lipocard do one, and it essentially looks like a soap bar, and the Dove Beauty bar. And I like these as well because then it's not just more plastic. You've just got your little bar of soap, albeit it's not actually soap, it's a synthetic detergent. And that's really nice.
Yeah, CeraVe do one, but I found it a bit more tricky to get hold of those synthetic detergent bars. But I think they're a brilliant idea.
Yes.
Definitely great for the environment.
Let's put that as one of our top recommendations, the synthetic detergent bars, the Cetaphil Gentle Cleanser and the
CeraVe cleansers.
Yeah, so
and the SVR cleanser.
So cheap and cheerful.
Yeah. I wouldn't splurge on a cleanser.
There's no point really.
No point.
You want to keep your money for something else.
Yeah, keep your money for the leave-on products.
You talked about the apricot scrub of the 80s, and it used to have these very harsh, almost like little loofah brushes that went alongside it, didn't it?
Yeah, it was all the rage. Everyone was using them. And I remember putting it onto my dry skin to get a really harsh scrub. And then I'd put a bit of water, do another scrub, and then I'd wash the whole thing off. I mean, thank goodness I was about 14 at the time, so skin could tolerate it. But we don't use that sort of thing anymore.
No, because that's the difference, isn't it? That's what we think of as a mechanical exfoliator, where you're literally scrubbing something. But part of the problem with a mechanical exfoliator is that the skin isn't a completely flat surface. It's filled with little bumps that go up and down, like little speed bumps all over it. And when you're doing a physical exfoliation or a mechanical exfoliation like that, you're really just scrubbing away at the very, very top part of all of those bumps. Whereas with a chemical exfoliation, which is what we talked about with the cleansers, so the alpha hydroxy acids, the beta hydroxy acids, and of course the retinoid that people will use at night time, these are chemical exfoliators. And they are just a bit more clever in being able to remove essentially the top layer of the dead skin, but of the whole bump and not just the very top or the peak of the bump. And one of the things I see a lot in kind of teenagers now is this idea of still trying to scrub the skin. And I've just noticed more and more these tiny little bumps that they get just at the lateral aspect of the jawline, just up high. This doesn't happen in people who have acne typically. It's those sensitive teenagers, and they get lots of these tiny, look like little goosebumps. And so they'll try and scrub those. And actually, in doing that, it just makes the whole thing worse. So this mechanical exfoliation or scrubbing, we don't recommend.
No.
We're much more sophisticated.
Yeah, things have come along a long way.
Okay, I think that's a wrap for this episode. Thank you so much to Ellie for joining me today.
You're so welcome. Absolute pleasure.
And thank you for listening. Look after yourself, look after your skin, and don't forget your SPF. And we'll see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.